Welcome to Tuesday Tips. My name is Pam Dunwald. I am one of your nurse advocates with Your Nurse Advocate Consulting. And today we're going to wrap up our series. I don't know if you've been following us at all, but we're looking at the aging-friendly framework that is a national initiative and looking at ways to be more age-friendly in managing the healthcare of our seniors. So we are going to wrap things up with talking about one of the 4 M's. And the last one we're going to talk about is M for mentation or mental health. And I know the slide says the 3rd M, but I did this for another presentation and I got mobility and mentation swapped. So I apologize for that. But this is the 4th one. We've talked about what matters most. We've talked about medication. We've talked about mobility. And we're going to wrap it up today talking about mentation or mental health with the elderly. So have you ever wondered, what signs, what should you look for if an aging loved one of yours is struggling with some mental health issues? And we're going to talk a little bit about that because, our aging adults, when we look about, we're going to talk about delirium, depression, and dementia. And where depression, can get, all of us can get depression, but what makes it unique for elderly, it's usually other reasons that could cause some depression. So we're going to talk about those. Dementia, we're going to talk about some things like what is normal aging forgetfulness versus what might be getting us into trouble. And we're going to talk about delirium, what delirium is. It's vivid dreams, disorientation. It could show up, by when you're removed out of your environment. We're going to talk a little bit about what that looks like and how you can prevent that and when it may rear its ugly head, so to speak. So those are the topics we're going to cover in mental health for aging during this Tuesday Tips. So routine screening is really important. So they say anytime you reach the age of 65 or older and your annual Medicare allows you to have an annual wellness exam that's covered with some preventative tests and things like that. And so they recommend that everyone 65 of age or older should have a cognitive screen. Now, this can be done right in the doctor's office. There's many tests. The MOCA test is kind of popular, but it usually takes 5 to 10 minutes, and you just are asked a series of questions, and it's just to help sort out maybe if there's some red flags versus what's just normal signs of aging. So the other thing that by getting screening done is the screening also allows you to get early treatment. The earlier the treatment, the better. There's some medications out there that if you can get started on it sooner, it may help to slow the progress of the dementia. So again, involving family and caregivers. A real quick story about this is I had a lady at church. She became a client of ours, and she came up to me and she says, "Pam, can you stop over after church when you go?" And I said, "Sure." And she had called me on the phone because she hadn't been in church for a while. And so I went to her home and she says, "Pam, is there something you could do to help me? You've probably noticed I haven't been to church very, very often anymore." And I says, "Yeah." I says, what's going on with that? Is something bothering you or something I can help you with?" She says, "Well, I noticed that I'm more forgetful, and I'm very embarrassed and very, very afraid that if I go to church, I'm going to forget the names of my friends and people that I've known for so many years. I just can't bear that. And that's why I've been staying away from church." And so that became, the beginning of our relationship and helping her through her Alzheimer's disease, through her hospice and end of life care. So those little things, talk to your aging loved ones and try and get a pulse or get a feeling, about how they feel that they're doing, and allow them to be able to express their fears or their concerns. So what's normal? How many of you have ever misplaced your keys? Okay. How many have you put something down, walked away, and came back and said, "Now, son of a gun, where did I put that?" Okay. I am going to be 65 next month. So, those things are normal signs of aging. So making a bad decision once in a while, missing one monthly payment, and then saying, "Oh gosh, I forgot that payment," and then get it taken care of it. Forgetting which day it is for a minute, sometimes forgetting which word to use. Like you can't think of somebody's name, or you can't think of a movie star's name you're trying to think of, or a song or something like that, or, losing things from time to time. Those are all signs of normal aging, and we're all going to go through that. But when you're looking at dementia, you're looking at Alzheimer's disease, these poor decisions become, more often. For example, leaving the stove on, walking away, doing something else, and totally forgetting what you were doing in the kitchen. Now, I've left the stove on once or twice before, but I've walked away and it's like, oh, darn, I left the stove on. I need to turn that off. When you have struggling with dementia, that's gone. You don't think to actually connect the dots to come back and then remember that you did leave that on. So that's kind of the difference there. Problems taking care of your monthly bills. If you walk over to your aging parents or your grandparents' house, you see a stack of bills and papers all over the dining room table, and that's a good say, hey, are you doing okay? Do you need some help going through this? Are these your bills here? Just try and be very how do I want to say, not very accusatory, just kind of try and bring it up as casually as possible. We run into trouble if people are starting to have trouble having a conversation. They're not able to complete their sentences, or they're misplacing things often and unable to find them. So, one of this gal from church that I took care of, I mean, she was always trying to make sure her husband didn't lose his glasses, but he could never find his glasses because they were maybe in her underwear drawer, in the freezer. One time it was in the microwave. So this is the big difference. So possible causes for change in mentation. It doesn't always have to be Alzheimer's. It doesn't always have to be dementia. It could be medications, narcotic pain medications. In the hospital, Tylenol goes a long way with pain management with our adults. Oftentimes that they can, even after hip surgery, their pain can be managed with scheduled, Tylenol, versus getting into those opioid, those heavy duty pain medications, which can make them confused, make them drowsy. They make them at risk for fall. Sleeping pills, anti-seizure medicines, any of the medicines they're taking that could make them sleepy or change their mentation will put them at risk. Illness, urinary tract infection in elderly is very common that we see altered mental status, mentation changes. And a lot of times it comes down to checking a urinary tract infection, and that's positive. And once we get them on antibiotics, they do much better. So something as simple as that, a stroke, a TIA, or a transient ischemic attack, which is like a mini stroke. The symptoms come quickly and then they also resolve quickly. Dementia, diabetes, low oxygen. If you have a pulmonary disease such as COPD or pneumonia, and you're thinking, you've been short of breath, and all of a sudden you're getting confused, that's probably a good sign to go into the emergency room, because you may have pneumonia, and you may be your oxygen level may be too low, and that could cause confusion and changes. Injury, traumatic brain injury, falling and hitting your head, liver disease, mental illness outside of, where you have actually a psychiatric disorder that needs treatment. So there's lots of things that can cause changes in mentation. So it doesn't always have to be dementia. If you are diagnosed with a diagnosis of Alzheimer's, there's many, many resources out there. There's many things that you can do. Advanced life planning, there's help at home, local services, medical care, home safety. We can, as nurse advocates, we work a lot with dementia patients, just coming to their home and just like putting the whole plan together. What do they need? Who do we need to bring in to make it safe in the home? Who do we need to bring in to help the family know how to handle and manage the care? And so we, as nurse advocates, we can help put those plans and put those pieces of the puzzle together for you. So let's move on to depression. So depression in aging adults oftentimes is caused by different things than depression in younger people. So for example, major depression would be severe symptoms that interfere with work, sleep, ability to concentrate, eat, enjoy life. Maybe a single episode, or it may last for a bit longer. Then there's persistent depressive disorder. It's less severe symptoms as major, but the symptoms can last up to a couple of years. And then there's minor depression, which we're going to talk a little bit about, especially in aging adults. We're going to talk about the difference between depression and grief. So one thing that we have to understand with our aging adults is that as they get older, their circle is shrinking, which means their loved ones, their siblings, their friends, they're passing away, and before you know it, their circle of socialization is gotten really, really small. And that can be very depressing. They start questioning, well, why am I here? What is my purpose anymore? So then they may pull back. You may see some social isolation. They're not going to church, or they're not going to card club, or they're not going to the senior center for activities. So these are some of the things that we would look at. And especially, when you have a loss of a loved one, I'll take my mother-in-law, for example. When she lost her husband, I mean, it was a good year before she really got to the point where we could all feel that she was back to normal. So everybody grieves in different stages, but any symptoms of depression that are persisting more than a couple of weeks may be something more than grief, and we'd want to look into that. So usually grief resolves itself. I'm a firm believer in grief group. I know, going to a group and talking about that can be hard, but I know, again, my mother-in-law, she went to a grief group after my father-in-law passed away, and she said it was very comforting because everyone in the room had lost a loved one. And so therefore they all knew what each other was feeling. And she found a lot of comfort in being with a group of people that understood what she was going through. The last thing we're going to talk about is delirium. Delirium, again, there's multiple reasons why they can cause delirium. Like I said, delirium is like vivid dreams, or snakes are crawling out, or the spider's coming on me, or there's a goat outside, the hospital window. All of these things, we could get into behaviors, and people could get agitated and get aggressive. And it's not so much that they're wanting to be mean, but they're truly scared of what's going on. And sometimes people that have early onset of dementia, or have some of these other illnesses that can cause changes in mentation, these people, we find that they're at greater risk for maybe having these periods of delirium, especially when they're removed from their familiar environment. But again, medications can cause it, illnesses can cause it, injuries, as we had mentioned before. It's not really clear how delirium develops, but there's a lot of potential causes. Sepsis, which is when you have a pneumonia or a urinary tract infection or some other infection in your body that takes over your body so much that it gets into your bloodstream. And this could be a life or death situation. So this is one reason why people could have that delirium. We talked about the urinary tract infections. And, COVID is another one. People that are suffering with that, again, being in the hospital, having surgery, elderly people that are coming out of anesthesia can often have these periods of delirium, and usually they clear once the anesthesia medication clears their system. So again, who are at risk for these periods of delirium could be advanced age, brain disease such as dementia, stroke, Parkinson's disease, especially like we'd mentioned when there's already memory issues, uses of multiple medications, particularly any psychiatric drugs or sedatives or just having a multitude of medical conditions. These are, again, some other instances of what could be causing delirium. Bladder catheters, and there's a whole medical reasoning behind that, or poor eyesight, sleep deprivation. Sleep deprivation, you can actually see things that are not there in front of you. And that's just from being sleep deprived. And that's really when you're getting into true sleep deprivation, where you're actually seeing things that are not there. So as we wrap up on mentation, just in closing, just want to say that, some changes in mentation are normal signs of aging. So it doesn't mean that all of a sudden you have dementia, but you should start to get screened after the age of 65, and early detection, can help get a handle on that, or give you peace of mind that you're not developing dementia. We're going to look at what could be causing the changes in mentation, early treatment, seeing an aging specialist. A lot of time our family practice physicians are good, depending on your area. More in the rural areas, the family practice Providers are usually broader spectrum in things that they treat. And when you get into the cities, they're much more specialized. So depending on where you live, you might want to look at like a geriatric specialist, a geriatrician, and they are ones that are very, very savvy in caring for aging adults, especially with aging adults with dementia. So you may want to seek a specialist there. We went over the 10 strategies to consider with Alzheimer's. We reviewed depression and we reviewed delirium. So if anyone is live with us tonight, if you would like to jot down any questions that you have, I'll wait just for a moment. And this is going to wrap up our Tuesday tips. And we will have this available in our Facebook group. We have a private Facebook group speaking out on the care of your aging parents. And we have discussions, we provide tools. It's an open forum. You can express your frustrations and anything about caring about aging parents and our aging loved ones. So please hop over and get supported there. We're all in the same boat. Linda, my partner, is currently knee deep in the weeds with her mom on hospice. And I am also working through some health challenges with both my mother and my mother-in-law. So we're right in there with you. And we love to share our knowledge and be of service to you in helping you get through these challenges as being a caregiver for an aging loved one. I don't see any questions popping up. So with that being said, we're going to wrap this up and we will see you next week for more Tuesday tips. Take care.